Transitional care is a unique program for patients that don't need acute hospital service anymore, but still need a little extra time and support to get back to daily life. Typically, a hospital stay includes acute care where you are needing close medical attention. But when you're ready to move from acute care and transition to swing bed or transitional care, it allows you to remain in the same room, just with a new focus on rehabilitation and recovery. Patients that are ideal candidates for transitional care include those that are recovering from complex surgeries, serious illnesses like heart attack or stroke, or those with chronic conditions that require close follow-up. And this could be a new diagnosis or something that you've been dealing with for many years.
So in transitional care, our goal is to prepare you for your permanent living situation. We really try to make things as close to your normal routine as we can. So we encourage you to get dressed daily, be up and moving, get out of your room, participate in those self-care tasks, and then you'll work with therapy, occupational therapy, physical therapy, speech therapy, or respiratory therapy. We usually see you 1 to 2 times a day and just working on those things you need to do to prepare you to go home.
At TMH, all of our rooms are private. We have large, spacious rooms that have a bathroom and a shower in them. And in those rooms, we have enough room for therapies to work with the patients in the rooms, but we also have a dedicated gym space that they can work in with the therapists.
For occupational therapy, we really focus on maximizing patients' independence and confidence and safety in all their daily tasks. So we start with basic self-cares, like making sure patients can get themselves dressed, get themselves to the toilet, moving around their environment. And then we progress to higher level things like meal preparation, medication management. We even offer home safety evaluations after discharge or before discharge if patients need in preparation for going home. We really take a patient-centered approach, so we like to ask patients what they need and want to do so we can focus on those things before they leave.
The role of physical therapy is really about first assessing a patient's function in regards to things such as walking, strength, range of motion, balance, in terms of getting a sense of where they're at in life. So that way we can build a plan for them that's personalized to help them achieve their goals.
So our speech therapy team for transitional care helps with people who are having trouble either with swallowing or with cognition or communication, which might be existing problems that they had prior to their hospital stay, or it might be a new problem that's come on with their hospital stay, and they might need some rehab in those areas before getting back home.
Through our volunteer services department, our program offers life enrichment activities that keep patients mentally and socially engaged, making the recovery process not just a physical journey, but a positive, well-rounded experience. We also have access to specialty services like orthopedics, lab work, imaging, and infusion therapy services that may not be available outside of the hospital.
So our typical length of stay in transitional care is about 12 days, but that varies greatly depending on what you need or what you're here for. We really like to meet patients where they're at and make sure they feel confident and comfortable before we send them home.
Every Tuesday and Thursday, we do bedside care rounds, which includes the patient and their family if they are available, and the care team that's working with them. And during those care rounds, we discuss their goals, their barriers to discharge, and any equipment they might need at home or wherever their next level of care is, including equipment, if they need rails in the home for safety. They talk about getting rid of any throw rugs if it's a safety hazard, shower chairs, anything like that. On our website, we have a link that tells you more information about our transitional care program, and it will also include a phone number that you can reach out to or an email address that you can use to ask any questions you might have about the program.
So being familiar with your insurance, reaching out to your insurance carrier, asking them questions about skilled nursing benefits or swing bed benefits, making sure you have that benefit. Or you can also reach out to us. We can help you navigate that process, do the checking for you, and help you whatever way we can.
Being close to home makes it easier for loved ones to play an active role in the recovery process. Transitional care at CMH is designed to provide a safe, comfortable bridge back to health. It's not just care, it's the support you need to return home at the highest level of independence with confidence.